Welcome to our video lesson on Chapter 18, the heart.
These are some terms that will be referred to in this section. Artery, a blood vessel that carries blood away from the heart. Vein, a blood vessel that carries blood to the heart. Atrium, receiving chamber of the heart. Ventricles, discharging chamber of the heart. Arterioventricular valves, prevents backflow into the atria when ventricles contract. Semilunar valves, prevents backflow into ventricles.
These are the external structures of the heart. Deoxygenated blood enters the heart through the superior vena cava and the inferior vena cava. Deoxygenated blood exits through the pulmonary artery to the lungs, and oxygenated blood returns to the heart through the pulmonary veins. Oxygenated blood exits the heart through the aorta to join the systemic circulation. There is also a network of coronary arteries and veins that supply the heart itself. These are the internal structures of the heart. The right atria, the right ventricle, the left atrium, and the left ventricle. There are two sets of valves. The atrioventricular valve, or AV valve, connect the atria to the ventricles. These are the tricuspid and bicuspid valve. An easy way to remember this is to try before you buy. The AV valves are held shut by chordae tendineae that are connected to the papillary muscles. The other set of valves are the pulmonary semilunar and the aortic semilunar valves that have flaps that shut to prevent the backflow of blood into the heart.
These are the four layers of the heart wall. Pericardium, a double wall sac that enclosed the heart. Epicardium, a visceral layer that lies against the pericardium. Myocardium, a muscular layer that forms the bulk of the heart. This is a layer of the heart that contracts. Endocardium lines the interior wall of the heart.
There are two circuits of blood flow. Pulmonary, which is to the lungs, starts with the inferior and superior vena cava to the heart, to the lungs, and then back to the heart. The systemic circulation is to the body. It starts in the heart, to the aorta, to the arteries, to the arterioles, to the capillary beds, to the venules, to the veins, and then back to the inferior and superior vena cava.
This is the path blood takes as it flows through the heart. Deoxygenated blood enters the heart from the inferior and superior vena cava into the right atrium. That blood flows passively through the tricuspid valve into the right ventricle. During contraction, this tricuspid valve closes and the pulmonary semilunar valve opens, pushing blood through the valve into the pulmonary artery or pulmonary trunk. This blood flows into the lungs where it is oxygenated by the alveoli. The blood returning to the heart is oxygenated and it enters through the pulmonary veins, which are at the posterior side of the heart. This blood comes into the left atrium through the bicuspid or mitral valve and into the left ventricle. The left ventricle has thicker walls because it has to contract harder to push the blood through the aortic semilunar valve into the aorta and through the systemic circulatory circuit. And that is how the blood flows through the heart.
These are some terms that will be referred to in this section. The sinoatrial node is the natural pacemaker of the heart and causes the atria to contract. The atrioventricular node has a delay of 0.1 seconds and carries impulses to the bundle of His. The bundle of His conducts impulses to the bundle branches through the interventricular septum. The Purkinje fibers are embedded in the ventricular walls, causes both ventricles to contract simultaneously.
The electrical conductivity of the heart begins with the SA node, also known as a sinoatrial node. It sends an electrical signal to both atria simultaneously. This signal continues to the AV node, also known as the atrioventricular node, where it is delayed for 0.1 seconds to allow the atria to contract. Impulses pass from the atria to the ventricles via the bundle of His and then splits into two pathways in the interventricular septum, carrying the impulse to the apex of the heart and into the Purkinje fibers, causing ventricular contraction. This system allows the cells of the heart to act as one muscle.
This is the electrocardiogram, which measures the function of the heart. The P wave is atrial depolarization. The QRS complex is ventricular depolarization. The T wave is ventricular repolarization. And you cannot see the atrial repolarization because it is masked by the QRS complex. If there are any disturbances in this wave sequence, it is a sign of a deficit in the heart.
So these are the terms that you need to know about the heart. A corresponds to the superior vena cava. B corresponds to the inferior vena cava. These are the vessels in which deoxygenated blood returns to the heart. C is the right atrium. D is the tricuspid valve, which is one of the AV valves connecting the atria to the ventricle. E is the right ventricle. F is the pulmonary semilunar valve. Blood goes through the semilunar valve into G, which is the pulmonary artery or the pulmonary trunk. Blood then goes into the lungs, becomes oxygenated, and returns through H, which are the pulmonary veins. From the pulmonary veins, blood is drawn into the left atrium and through the bicuspid or mitral valve, which is J. And into K, which is the left ventricle. From there, it goes through the L, aortic semilunar valve, and into the aorta, which is M, completing the pulmonary circuit and then entering the systemic circuit. Next, we're going on to terms that have to do with the electroconductivity. First, though, is N, which is the apex of the heart. The heart lies pointed slightly left inside of the chest, and so the apex will always point towards your left arm, behind the sternum or the mediastinum. O is the first term for the electroconductivity, which is the sinoatrial node. P, right here, stands for the fossa ovalis. Which used to be a hole within our heart connecting our atriums that closes before birth. Q is the AV node, or atrioventricular node. R is the bundle of His. And S are the Purkinje fibers. These are the terms that you need to know when studying the heart.
Bye guys, watch my heart in action.